everybody, I'm Jocelyn Momenta.
And I'm Vicki Veltri. I'm Connecticut's healthcare advocate.
And we're here to talk to you about the Affordable Care Act and what it means for you. The Affordable Care Act, Vicki, is a very complicated issue, and many people actually know it as, in so many ways, ACA, Obamacare, healthcare reform.
That's right. It's a very complicated law. It's over 2,000 pages in legislation, so it's going to take a few years for people to really understand it, I think, and it's taking a few years to roll out. Just as another name people know it by is the Patient Protection and Affordable Care Act.
But they will mostly hear it as?
The ACA, probably, or Obamacare. Those are the two most frequently used names.
And where is Connecticut in the process?
We are very far ahead in the process. So there's two kinds of processes going on. One is the rollout of a lot of the healthcare reforms that are in the Affordable Care Act, some of which are already in law, and then the health insurance exchange, which I know we're going to talk about too.
Absolutely. First of all, why do we have this Affordable Care Act?
Well, we have it for a very simple reason. We have 45 million people in this country without health care coverage. It's just unacceptable. And the Affordable Care Act is the technique or the law that came about to respond to that and to get people hooked up to health care, to finally get people a source of coverage and a doctor they could go to regularly, get them health care without going through the kinds of burdens and obstacles they've had to go through before to get health care.
Too many people were going without health care.
That's right. If you think about 45 million people in the United States out of a country of 350 or so million, 350,000 people just in Connecticut alone without insurance. So we really needed this legislation.
All right, so let's take a look at this. The vast majority of people who are now covered by their employer will really not see a change. Is that right?
That's correct. Most of the plans that are offered by employers are so-called grandfathered plans. Just like we use the term grandfather to describe laws that come into place and people that get grandfathered in. This is the same sort of thing with the Affordable Care Act. And under that provision where we say anybody who has health insurance that they like right now gets to keep it, that's what happens with these employer plans.
And if they don't like, they could possibly change it if they want to.
That's correct. If the employer doesn't like it, they can change their plan. If a person doesn't like their plan, they can switch to.
All right. But according to the Affordable Care Act, everybody has to have insurance.
That's right. And the reason for that is kind of simple, if you think about it. People who really need insurance these days tend to be people who are sicker. And insurance works on this principle of trying to share the risk that's in the pool of people. So the more people who are covered and the more healthy people who are covered, the lower the prices, the more the risk is spread out. So that's why there's a so-called individual mandate in the Affordable Care Act. It's to get those healthy people in.
But if you don't sign up, what happens?
You're going to get a penalty if you don't sign up.
What kind of penalty?
There's a penalty that's assessed as part of your tax return at the end of the year. And it depends on what your income is. So if your income is very low, you might even be exempt from a penalty. But the higher your income, the more of a penalty you're going to pay if you don't have insurance.
Let's take a look at what some of these changes mean.
Sure.
And we have a list of it right here. Let's take a look at this. The first one is that no more pre-existing conditions.
Yes, and that is one of and I would say the biggest obstacle to many, many people getting health care. In fact, if you're between the ages of about 50 and 64 and you're uninsured right now, very difficult to buy insurance because chances are you have a pre-existing condition. So the Affordable Care Act says, you know what, if you have a pre-X, what we call a pre-X, you're not going to have the problem of not being able to buy a policy anymore. That is huge. And also the insurance companies won't be able to say, you know what, we'll give you a policy, but we're not going to cover you for the condition you have. So those two things are the pre-existing condition exclusion and the pre-existing condition bar on buying coverage are both eliminated.
And it was also affecting families with sick children.
That's correct. Sick children couldn't get policies either. And it wasn't until the Affordable Care Act went into effect that the pre-existing condition exclusion for children went away, right away.
It forced the insurance companies to do that.
That's right. It forced the companies to write those policies because what they would do before is not write a coverage policy. So people with sick children or themselves who are sick would be going without health care coverage, which only contributes to the skyrocketing costs of health care because people tend to go to EDs, emergency departments, and other sources of care if they don't have health care. They wait until it's an emergency to go for health care.
Let's take a look at the second point. This also is a preventative health care is is covered here as well. It includes mammograms and colonoscopies.
Yes, among many different services that are covered at no charge to consumers going forward. And that is by design to encourage people to get preventive care so they don't wait to go get costlier care. The idea is you will get your physicals, you'll get your mammograms, your colonoscopies, cholesterol testing, high blood pressure screenings, mental health screenings. The idea being get to the doctor now, get those screenings, and if you need an intervention, you'll have it now before it becomes a catastrophic need.
Makes it really easy for people to do it,
That's
to get
right.
it done.
That's right. That was by design. Again, the design being no cost sharing, meaning no more co-pays for those kinds of services, no deductible, no co-insurance. So it's free. Go to your doctor.
That's right. And in fact, that's what are some of the other changes here is also that up to age 26, kids can be still covered by parents, no restrictions as well.
Yes.
Is that correct?
That was a huge provision in the act. Connecticut actually led many of the states. We already had a provision before the Affordable Care Act came out that would allow people in plans that were covered by the state to get insurance for their dependents up to 26. But when the Affordable Care Act came along, it helped all the other people in Connecticut who are not covered by plans that the state regulates. These are called self-funded plans. So if you were in a large employer, you may not have had that benefit. And now you've got it.
And also, if students are married, is that right?
That's right. Student can be married and you can still get the coverage. That's correct.
Love that. The other change that might affect somebody is no spending caps.
That's right. So the ACA, Affordable Care Act, also says, look, we know a lot of people, especially people who have been ill, they come in to their insurance policy and they may use a lot of care. And they may go right through the cap on their policy. Many people have like $1 million cap. Some people as low as $500,000 or $100,000. The Affordable Care Act says, you know what, we're not putting a limit on that anymore. We're lifting those limits. So if you are ill, you will get the care you need.
Let's take it the last one. Drug rates rather, should be cheaper for those on Medicare. How does that work?
That's right. So in Medicare, there was this thing called the donut hole. I think that's what most people know it as. And that's a part of the coverage where you get into after you've spent or have gotten some coverage in Medicare Part D, which is the drug coverage under Part D, where you all of a sudden would have no coverage. That's why it was called the donut hole. And under the ACA, that donut hole is going to shrink and go away by 2019. And in the interim, there's going to be a lot of help for people to purchase drugs while they're in that donut hole. They're going to get substantial discounts on both generic and brand name drugs.
So they can really expect to see their drug costs go down.
That's correct. That is correct. That's another one of the advantages of the ACA.
So if a person who can't afford the coverage isn't able to do that, how do they qualify for financial help? Is there financial help for somebody out there?
There is financial help. So there's two important things going on in the Affordable Care Act in 2014. By January 1st, 2014, Medicaid eligibility will increase. So people in Connecticut right now can get Medicaid as an adult, but only if they make about $500 a month or so. That eligibility is going to go up 2.5 times that amount in 2014. So more people will be able to enroll in Medicaid. In addition to that, depending on your income, and you could be up to $92,000 for a family of 4, you can be eligible for federal financial help to help you purchase insurance through the exchange.
So that really is going to be so beneficial for especially that family of 4.
Yeah, and that's what we hoped, is that through the Affordable Care Act and through this federal financial help, which frankly is going to be very easy for people to get, it's going to be almost transparent to them, that will make people want to buy the coverage, because it would be so much cheaper than them going right now into the insurance marketplace and trying to buy a policy. It's almost unaffordable right now for many people.
Well, let's talk about how it'll impact small businesses.
Okay, sure.
As we know, a lot of small businesses out there can't afford a whole lot out there, but
that's right.
This will also help them?
Yes, so there's a couple ways it could help them. One is, and one thing that I would like to get the word out on a lot about, is there's a small business tax credit available to small businesses to purchase insurance. for their employees. Many employers do not know about this credit, but depending on how much you're paying your employees and the size of your business, you can get a substantial tax credit up to 35% of the cost of the insurance, to purchase the insurance. That's one thing. The other thing is, in 2014, there's going to be a special marketplace set up for small businesses to help them purchase insurance. And in that marketplace, a lot of those costs that small businesses have to try to find coverage for their employees, all those administrative costs, will be taken away by this insurance
So this will
exchange.
really motivate small businesses to cover their people and people that they want to keep employed.
Right, that is our
Because it's hard
hope.
to find good people to hire.
Right.
So you want to maintain those folks.
Right, and as you know, having an insurance benefit is an attractive thing to get employees to work for you. So that's the whole idea behind this, what we call the SHOP exchange, the Small Business Health Opportunities Plan. And so we're hoping that that will be successful in 2014.
You touched upon it already, but let's talk more about the healthcare exchange. What exactly is this?
That is what we call a marketplace. So think of the health insurance exchange and what is now called Access Health CT. So when people see that name, I want them to know that it's the exchange. That is kind of like Expedia or Travelocity. You know, you're going online, you're comparing plans, or in Travelocity's case, prices for airfares. You're able to compare plans by the exact benefits they offer, by the provider network they offer. So is your provider in the network or not? By the amount of cost sharing you might have, so what you might pay out of pocket. So you can compare things on any number of levels and then choose a plan and buy it right there.
Excellent. Now, if people need to get more information and help, where should they go?
Well, on any of these issues, and they have any questions or concerns, they really should come to the Office of the Healthcare Advocate. We're there to help them with their questions or concerns. Our toll-free number is 1-866-466-4446. We also have a website, which is ct.gov/OHA. We do speak Spanish and English. We are educators. We advocate for people. And we help people with their health care problems at any point in time.
A lot of information here, Vicki.
Yes, quite a lot. Quite a lot of information, but people should feel free to call us anytime. We're there 5 days a week. We check our phones 24 hours a day, so we are there for you. I am Vicki Veltri, and I'm your healthcare advocate.
And I'm Jocelyn Lementa. Check out our other videos that will be available for you. Thanks for watching.